Okay, I think we have the recording started. We will start our program in about 45 seconds. I want to make sure that everybody who wants to participate can get logged in and have their screens pull up the conversation. I'm looking forward to the conversation. I'm sitting here in CEI's Fred L. Smith Values-Based Communication studio, and I know Fred is participating from his home in Maryland today. So good afternoon, Fred and Fran. Thanks for being with us. We'll get the program started in just a few seconds here. Okay, welcome everyone. Today we have a policy forum at the Competitive Enterprise Institute. For the next hour, we'll talk about lessons from the pandemic lockdowns in a way that I think you've never heard. My colleague, Dr. Joel Zinberg, partnered with Brian Blase, Eric Sun, and Casey Mulligan to produce a new study that examines various economic restrictions and the effects on health, mortality, education, and mobility. I'm Kent Lassman, president of CEI, and my guests today, both Joel Zinberg and Brian Blase, will help us unpack this study. Brian is the president of the Paragon Health Institute. Very happy to partner with him and work with him on these issues. And many of you know Joel already from the good work that he's been doing with CEI for several years. If you'd like to join in the conversation, we'll be taking questions throughout the hour-long program. To ask a question, please find the Q&A spot there at the bottom of your screen. Type in your question and it'll get fed to me on a monitor right in front of us. Or send an email to events@cei.org if the email is easier for you than the touchscreen. I want to start with what should be an obvious observation, but sometimes we skip over. And that is the human toll and severity of the COVID virus. It's not diminished in the least when we examine the policy choices that were made. In particular, in some parts of the country, lockdown policies made it more difficult for people to learn how to cope with the pandemic and to adapt, all the while creating novel problems that have long-term effects. To understand what policies were on net too costly, it's necessary to have a systematic analysis of both the various policy outcomes and the policy choices. And that's what my guests today have done. There will be some discussion of methodology, but most importantly, a lot of conversation about what has been learned. So I want to start by turning to my colleague, my friend, Dr. Joel Zinberg, and ask you to walk us through the paper. What did you find with this study, where I think the headline is right there in the title, and that is that freedom wins?
Thanks, Kent. I know this is a topic that you and I have been discussing for quite some time, and how could one avoid it? Because over the past 3 years of the pandemic, we've been subjected to really unprecedented government interventions in our society and in our economy. And I mean unprecedented in terms of the severity of those interventions and the duration for which they were imposed. And naturally, we kind of wondered, was this all worth it? These were presumably imposed to improve health outcomes. Did they improve health outcomes, and what sorts of side effects did they have? So, we, in just thinking about this, we kind of took advantage of the fact that we work in a federalist system where the Constitution reserves health policy making primarily to the states, so that each state and the District of Columbia were able to make their own health policies. So you essentially had kind of a natural experiment. So you could see the different approaches in terms of these sort of lockdown measures. And here what I'm talking about are things like business closures of schools, closures of synagogues, closures of entertainment venues, stay-at-home orders. And in addition, you had economic measures that things like economic supports or suspensions of government contracts or various debt obligations. You had health measures, things like masking requirements or vaccine programs, all of these things which we kind of collectively refer to as lockdowns, were imposed in different ways in all 50 states and the District of Columbia. So we had this natural experiment, and we were able to take advantage of the existence of a measure of the severity of those outcomes, which comes from the Oxford School of Government. It's called the Oxford Government Response Tracker. And they were collecting information from around the world, really, and from all 50 states, to measure the different types of government responses, and they compiled them into different indices. And we chose the most comprehensive one, which was the Government Response Index. And then we decided to compare them with measures of health outcomes, economic outcomes, and educational outcomes. And these came from a prior study done by Casey Mulligan, so that he was looking, he didn't have a direct measure of government measure severity, but he was just comparing the economic outcomes with the health outcomes and the education. So the health outcomes were measured by COVID mortalities, adjusted for age and underlying disease prevalence, plus excess all-cause mortality. The economic measures were GDP changes per state and unemployment changes. And the school measures, the education measures, were numbers of in-person days in school, which we know from other studies correlates with educational outcomes. So we're able to compare those three outcomes with the Oxford Severity Index. And what we found was that the severity of lockdown measures had little or no relationship to health outcomes. But what we did also find was that you ended up with strong negative correlations with bad economic outcomes and with poor education outcomes in terms of number of days of school. So you can illustrate this by looking at figure 1, which comes from our paper. And just so you'll see the x-axis on the bottom there is the Oxford Response Index, and this is laid out in terms of z-scores, which is a standard deviation from the mean, which you see right there in the middle, 0. And on the y-axis is the health outcomes score. And what this shows is there's a very small and actually statistically insignificant relationship between government interventions and health outcomes. But then when you look at figure 2,
I want to note here and make sure that I understand and our audience understands. As we look at the scale across the bottom, your x-axis you described as the z-scale, using standard deviations. The Oxford Government Response Index, as I understand it, and please correct me, it's not making a judgment about whether a more open or more closed society is good or bad. It's simply measuring, is it more or less open?
Correct. That's so absolutely.
Okay. And I think that's important for people, that there's not a value judgment on that question, but by having this standard index, it allows you to see the effects in economics and health, et cetera.
Correct. And so when you go to the right of the axis, numbers 1 and 2, the positive numbers, that's more severe, greater in severity and duration. And when you go to the left, that's less severe. So you'll notice, for example, New York, which is at the far end to the right, has the most severe, and up there with Hawaii and California. And at the other end, you've got states like South Dakota and Utah. And then on the economic outcomes, the higher you are, the better your economic outcomes. In other words, the less decrease in GDP, the less increase in unemployment. And so this is showing our economic outcome. And here there's a strong negative correlation. And you can see all this in actual figures in our table 1. So here, what you see is you'll see the actual regression coefficients here. And in that first column, it's unweighted by anything. It's just the actual outcome measures. And then you'll see in columns 2 and 3, we did robustness checks because we were concerned about two possible issues. One was, there was some question of whether there would be a differential impact if you were a big state versus a small state. So we did a population weighting, and you can see the results there in that second column. And then we did an additional robustness check in the third column because there had been some publications questioning the impact of population density. There was a thought that perhaps COVID would spread more easily in more densely populated areas. So we adjusted for population density in the state plus the population weighting in that third column. And what you can see is basically the results are unchanged, except there's one very important thing even. If you look at the second row, which is health outcome score, it goes from there being a small but statistically insignificant relationship to being essentially zero. You'll see it becomes 0.01 and 0.02 in the third column, again, statistically insignificant, but all the other measures stay the same. And what you'll see in that first row is that we had actually calculated an overall outcome score, which was an equal weighting of the three outcomes, health, education, and economics, to do this sort of overall thing. And again, you see it's strongly negatively related to the severity of the lockdowns. So this is sort of the finding, and it's unique in that we actually had this comparison to an independently compiled quantitative index that was created by this third party by Oxford. Now, we also did something else which I think is relatively unique in that we wondered what impact would this have on people's decisions where to live. So we did look at migration and see if this influenced people's decisions on whether to move state to state. We'll get into that in a bit more. And finally, just to exemplify the outcomes and these various inquiries, what we did was compare two large populous states, Florida and California, that took very different approaches to lockdowns, California being extremely severe and Florida being kind of the standard bearer for a more relaxed approach and a more focused protection approach. And we compared them in depth during the paper. And we can talk more about that at the end. But I do think that, what that illustrates is that states like Florida, just like countries like Sweden that took this more relaxed and so we would argue more scientifically based actually approach, did much better than states like California.
Well, let's get Brian into the conversation here. We can talk a little bit about that migration. And for those who are unaware, I want to make sure we'll put in the show notes and we'll email it out for the participants. The paper is available online. It's been published by the Paragon Health Institute. I believe we have a link on our website as well. All of these tables and the chart, the summary chart that Joel talked about, they're worth a look. They're worth spending some time with. We have 4 co-authors. 2 are physicians who have worked in academia. 2 are economists. And I believe all 4 have worked at the White House. So the highest levels of our national government, very familiar with the development and analysis of policy. Brian, if you'll excuse that little commercial, why don't you jump in here and talk a little bit about what else was found in the study vis-a-vis migration, because that is a really interesting dynamic for how our economic growth and dynamism works in America. And I know you have your own personal familial story to add to the anecdote to the substance here.
Hey, thanks, Kent, and I appreciate the commercial. It was during the White House experience where I met Joel. He was at the Council of Economic Advisors, and I was at the National Economic Council, and we got to collaborate then. And I'm fortunate to share him with you and all the great work that he does for our organizations. Just one general comment, and then I'll talk about migration. I mean, it was 3 years ago this month that things started shutting down because of COVID. And I think initially, a lot of those shutdowns made sense. We didn't know exactly who was at risk for the virus. There were sort of empirical models done. The Imperial College did one that estimated, I think, more than 2 million people in the US would die from COVID within the first couple of months. People were really scared, and people took their own personal sort of risk avoidance measures. And there was also a set of government measures at the federal and state levels. It didn't take that long, though, until we sort of knew the risk profile that people had from COVID. And it turned out that COVID was a high risk for elderly individuals and individuals with pre-existing medical conditions. They were at risk of hospitalization and death. But for most people, for children, young adults, those in good physical condition, it really didn't pose that severe of a risk. So then you started to see states take different approaches. At the time, I lived in Northern Virginia. Padlocked. I play tennis. They padlocked the tennis courts. Couldn't get on. I mean, you're literally in tennis. You're 90 feet apart. They wouldn't let us go and play tennis. We were 90 feet apart outside. They put police tape around public playgrounds. They shut down activities for kids. They shut down outdoor swimming pools in the summer. And I mean, worst of all, from the perspective of my wife and I, is that they closed schools, not just for the spring period of 2020, but extending into the next school year. I was fortunate to be in a position where I could leave Northern Virginia and the lockdowns. And it was not an easy decision. Like, we had lived there for 17 years and had made our community there, a lot of friends there, were happy there. But we wanted to move. There's a lot of other places in the country that are good places to live and that offer things like, no state income tax. A lot of states, we don't have a state income tax. And we sort of investigated our options and ended up in North Florida. And one of the main reasons we ended up there is because they kept the schools open going into the 2020-2021 school year. Governor DeSantis made it a real high priority that schools were going to be open for in-person learning for kids. It was clearly, at the time, it was a very controversial decision. There was a lot of pressure that was put on DeSantis, and there were other governors that kept schools open as well. But DeSantis is the highest profile and biggest state that took those actions. A lot of pressure from the public health establishment. But he correctly looked at the data and said kids aren't at risk from the virus, and there's huge costs from shutting things down, right? So there's huge, not just what Joel mentioned, the cost to economic outcomes and unemployment, but there's huge costs in terms of health outcomes, in terms of social isolation. In terms of kids going and using so much extra screen time because they couldn't go outside and go to school. So
how common was this? I mean, was this just the Blase household, or did we see this? Was it a trend?
So we got to look at pre-pandemic migration patterns with pandemic migration patterns. And the reason it's necessary to look at the pre-pandemic is that there was a fair amount of movement sort of away from northeastern states to the Sun Belt before the pandemic. So, people were moving away from New York, New Jersey, Connecticut, Massachusetts. Even on the, people were moving away from California as well. They were moving to states like Florida, South Carolina, North Carolina, Texas, and Tennessee. But we looked at the magnitude of the difference in the 2-year period after the pandemic with the 5-year period before the pandemic. And we found a couple of interesting things. One is that overall domestic migration, so we're just talking here about Americans moving from state to state. We're not looking at international people moving in from overseas. Domestic migration increased significantly starting in the summer of 2020, and that lasted for 2 years. So on the whole, my domestic migration increased by about 40%. And you see those existing patterns where, and you could bring up figure 4 right now, which shows our correlation of migration. And again, this is showing the pandemic migration change on the horizontal axis with the same measure, the Oxford Response Index, on the horizontal axis. I'm sorry, the pandemic migration change is on the vertical axis, and you can see that the states with more severe COVID restrictions, like California and New York, had a significant migration outflow. So California and New York, Kent, each lost more than 700,000 people to other states in the 2 years from July 2020 to July 2022. New York lost 1 in 30 residents on net during that 2-year period. California's, the magnitude of California's loss in people was about the same, but less of its state population. Migration.
So this sort of effect, let me interject there, Brian, because typically this sort of effect about internal population flows, we often talk about or hear about it only in relation to tax policy, right? People retire, they want to go to a certain type of tax treatment. But I think what you're showing us here on the left, less severe, which is both duration and restrictions, and on the right, more restrictions. We're seeing movement about the entire approach of government, an entire philosophy of government for how to treat people and how much decision-making they have about how they will live, how they'll interact with others, what risk prevention steps they will take or try to take. Is this a shift in this sort of internal competitive federalism type question? Do you think it's going to last for us through the next decade of analysis?
So I suspect it might. I mean, we took into account the fact that people were moving away from New York and California and to these states like Florida, Texas, Tennessee. So what we're showing here is sort of the extra effect of the pandemic responses on the movement that was already happening, right? So there was already a movement from New York to Florida, but with the pandemic, that movement significantly accelerated. And I think, I think that it's possible that that's going to continue, that these states have just done a better job of sort of matching government policy to the desires and preferences of the local populations.
That brings us maybe to our first question from the audience, and a reminder to everyone to be part of the conversation with Joel and Brian. There's a Q&A function at the bottom of the screen. You can also email us at events@cei.org. But I have a question here. I'll let you guys arm wrestle for who answers it. It comes from Peter, who I happen to know is a New Yorker. He says, he's referencing a comment from Joel. He says, you did a head-to-head comparison with California and Florida. Why not also do a head-to-head comparison with New York versus Florida, since the states have approximately equal population? And clearly you charted all the states, and so we can look at relationships, eyeball the relationships. How did you make selections for what to emphasize and not emphasize with the study and your head-to-head comparisons?
So we did actually, in the paper, talk about New York as well, although the in-depth comparison was done with California. But all of the points we made are actually even stronger when you look at New York. I mean, New York was a little more difficult, and we had concerns because New York, as the sort of initial locus of COVID in the country, you would expect there to be a large response and that people might leave. Although at the end of the day, we decided that that probably wasn't that big an issue, because in fact, the peak in New York ended at the end of April 2020. And basically by the late spring, early summer, New York was on the same sort of pattern, disease pattern as the rest of the country. And we actually, in terms of migration, this is sort of a quirk in the statistics, but it was a quirk that actually I think worked to our favor. The Census Bureau records their migration year as a July 1st to June 30th of the following year. So, for example, when you talk about 2020, you're talking about July 1st, 2019 to June 30th, 2020. And we decided, and so what we were looking at for the pandemic years was really 2021 and 2022. It started in July 1st of 2020. And that was important for several reasons. Number one, you would take out much of that effect of New York's early peak. And in addition, there were the tremendous restrictions on travel during the first several months of the pandemic. So we didn't want to look at that, particularly since if you were looking at that census year, 2020, you'd be looking at 6 months of a relatively normal year plus 6 months of the pandemic where there were severe travel restrictions. But the fact of the matter is, and I have written an article about this, separate from this larger paper, New York underperformed Florida in every metric. In fact, New York, whereas Florida and California have roughly similar health outcomes, New York health outcomes are among the worst in the nation, whereas Florida is about average. And again, New York is the worst in the nation on economic outcomes. It's very bad on education outcomes, whereas Florida is above average on both of those measures as well. So we did do that just in a less in-depth way within the paper.
Joel still resides in New York as well. I'm trying to make the case for him to move to Florida, but he's stuck in the Big Apple for the moment.
Well, I'm intent on maximizing my tax liability, so I insist on staying here.
I'm told by reliable sources that if you maximize your tax liability, that makes you a better citizen somehow. I'm not entirely persuaded, but that's at least what that's what I hear.
Joel's a much better citizen than I am then.
I
would say one of the interesting things about migration in New York is that it looks like the first year people moved relatively close to New York. So you saw not as much negative outflow from like New Jersey, Vermont, Connecticut, that people probably just moved out of the city to those states. But then the second year, it looks like people then started moving to further away to sort of where they wanted to ultimately end up. On the California-Florida comparison, I'd say one of the things that we found motivating is that the governor of California was very critical of the response of Florida. So I think we wanted to sort of check the statements that he had made and whether there was accuracy to them and actually do a comparison of how Florida compared to California. Taking into, I think Joel's right, the initial sort of epicenter was in New York. And I think for the paper's purposes, it just made more sense to compare California and Florida.
I'll note without further commentary that the four co-authors here, we have someone at Stanford in California, somebody at the University of Chicago in Illinois, and you did a good job of controlling for the previous migration patterns so that Illinois' exodus was not captured, and you could have some clean insights from the data. Could you talk a little bit about how does we're talking a lot about America, we're talking a lot about state versus state comparisons, but this Oxford Index not only created a model for understanding the lockdown policies in America, but it looked internationally. How does Sweden fit into all of this? There's some discussion here that I think will be interesting for the audience.
So we didn't look at Sweden vis-a-vis the Oxford Index per se, but we ended up in the discussion section of the paper likening Florida to Sweden in that both took what's called this focus protection approach. In fact, Sweden did it even earlier than Florida. So Sweden never closed down its schools for kids 17 and younger. It never required masks. the limited stuff, it left businesses open. The limited restrictions it imposed were things like suggesting social distancing in restaurants, suggesting that vulnerable people stay at home or avoid crowded public places. But basically, it left people to their own devices. It trusted the population. And the reality is, as you know, there's a lot of economic literature suggesting that voluntary responses in general, in response to sort of big pandemic type disease events, are far more important than anything the government does. And that indeed appears to be the case during the COVID-19 pandemic. There's a literature suggesting that people made their voluntary changes to avoid risk before the government imposed measures, and any kind of disease mitigation was primarily the effect of those voluntary changes. So the Swedish government decided to rely on their citizens, and not the Oxford Index, but a variety of other measures in terms of age-adjusted mortality show that Sweden did better than most countries in Europe. And so certainly, they were vilified at the outset that they were murderers and they were going to do worse than everyone else, and that was not the case. And at the same time, they did much better than the rest of Europe in terms of economic outcomes and in terms of educational outcomes. As I said, they kept their schools open.
There's an important term there that you used, and I think it's worth just spending 30 seconds on to make sure people, it's not lost on anyone what we're talking about, but you used something along the, you said something like all told mortality. The effects of these policy choices, it's not just a little bit of money in our pocket, or does it take 2 or 4 or 6 months longer to get people back to work and we can have an extended safety net. We're talking about death, right? So how did you account for, could you walk us again through the steps that you took to understand populations in different states had different risk factors for the disease and for mortality in general? I think that's really instructive because superficially, I know there's a lot of jokes about the type of people that move to Florida.
Well, this is the interesting thing that, as Brian alluded to, it was clear very early on in the pandemic who were the people who are most at risk, and that was the elderly. The infection mortality rate for someone 65 and older is about 100 times of the infection mortality rate for someone 25. And as you get to younger ages and older ages, you start to get even greater orders of magnitude. It's like 1,000 times. So it was very clear early on that this was a factor. So we knew you had to adjust for different states' age distribution. And unfortunately, a lot of what you will see, even to this day in the press and even in some academic journals, doesn't make that adjustment. They just compare raw per capita mortality figures. So we didn't do that. And what we note in the paper is so interesting is Florida has the second oldest population in the country, whereas California has one of the younger populations in the country, yet they took these diametrically opposed approaches. And Florida was relaxing all the lockdown measures by the late spring and summer of 2020 and by the fall of 2020 and moving into 2021. But they were really very early on this, whereas California had these prolonged lockdowns, even though you would have thought based on their age distributions that they would have been different. So we adjusted for age. And another thing that was very important, and this again became apparent pretty early on, was the other major risk factor for infection mortality in COVID was having underlying diseases. And that includes a variety of things, but 2 of the foremost diseases are obesity and diabetes. So we adjusted for each state's prevalence in making these outcome measures. So that's something that most studies do not do. And I'll add to, by the way, what you were saying, Kent, it's not just simply about the dollars, it's about the other impacts. So one of the health measures we had was all-cause mortality, and what Casey Mulligan has noted in some papers, and a variety of other authors, is that you had big increases in excess mortality, particularly in states with lockdown measures. You know, things like increased mortality from cardiac disease, people who didn't go to their cancer screenings, increases in obesity, increases in hypertension, things like that, that were related to a variety of factors, but not the least of which is that they couldn't get to medical care. There was increasing social isolation, increased alcoholism, increased rates of depression, increased rates of suicide. So these were all things that were important side effects of these lockdown measures.
I want to turn to Brian here for just a second. You mentioned the difference in the different years about migration patterns, right? First, people moved maybe a little bit closer to home. They were testing out, you know, what are we going to do? How long is this all going to last? And then people made bigger decisions about life and maybe moved farther away and settled, if you will. Do we have a similar, did you learn, or were you able to extract with your co-authors learning patterns? So it seems to me we have two different sets of learning. One is people learned how to live, right? In their homes, in their jobs, in their schools, in their local coffee shop. Citizens learned through the pandemic. But then there's the question, and again, it comes back to how you measured severity. Did elected and other public officials learn through the pandemic? There were the early movers with very severe shutdowns or more laissez-faire, but did we see some governors or some local leaders do anything of an about face and pick up learning from what had happened in Florida or Utah or these other states?
That might be a better question for Joel. I don't know if he's got information on states that changed. I think it's depressing how slow it took certain states to release their lockdown measures. I mean, you still had some states with various lockdown measures in the first part of 2022. So it took, I mean, the learning, I think there was people got into their like preconceived notions. And I think one of the things, I mean, I was going to add this to Joel's last comment, you know, it's sort of became, do you care about health or do you care about the economy? And sort of that dichotomy was unhelpful because it wasn't about just those of us that we didn't want society to open up because we just cared about the economy, right? We cared about people's entire well-being. And there's a lot of things that the lockdowns and the restrictions, you know, caused that hurt people's mental health, physical health, overall well-being. I mean, keeping churches and schools closed and that loss of sense of community could be devastating for individuals. And I think one of the things too is with the vaccine, like even like when we got the vaccine, I think there should have been a sense you get the vaccine, there should be a sort of restoration of normal life when you get the vaccine. And that was my hope with the vaccine. Like there would be a restoration of normal life. But in some of those lockdown states, they maintained mandates and school closures way past the time that we had vaccines widely available.
And I think this feeds into, Joel, if you wanted to speak to this, another question we have from the audience from Richard. He writes, am I correct? So it's a two-part question. Am I correct in thinking that we knew lockdowns were bad policy before COVID, but that didn't stop the lockdowns from being implemented? Have we now learned our lessons, or could lockdowns happen again?
Well, Richard is absolutely right. And this is one interesting thing we note in the paper, that most of the literature prior to this pandemic had concluded that lockdown type measures would not work. And this was people who were looking at the experience from the 1918 so-called Spanish flu, epidemic, which killed I think about 50 million people worldwide. And they had looked at what was done during that pandemic and what sorts of measures were taken. And they had concluded that these probably wouldn't work. And part of the reason that even papers that said, gee, some of these measures did show some impact on health outcomes said those lessons are not applicable to COVID, because the 1918 pandemic dealt with a very different virus. It was a virus where the peak mortality was actually in young, healthy people, not the elderly and not people with underlying medical conditions. And the lockdown measures that were imposed in 1918 were very spotty. They were not very severe. They averaged, in the few cities that did impose them, they averaged about 1 month. So no one thought that lockdown measures that were severe and of basically unlimited duration should be imposed. And this was reflected in a variety of pandemic planning that was in place at the outset of this COVID-19 pandemic. So you had the World Health Organization, the US CDC, a variety of other governmental agencies in other countries had pandemic plans that did not suggest we should impose lockdowns. So the question is, why did we impose lockdowns? Which is, I think, what Richard is getting at, since we knew this in advance. Mm-hmm. And I think we were completely misled by a lot of the epidemiological modeling that was done at the outset. And a particular culprit was the Imperial College modeling, which Brian alluded to before, which was predicting 200 million, excuse me, not 200 million, 2 million deaths in the US by the summer of 2020 if you didn't impose physical type of
this was almost like a Hollywood model, right? I mean, it was cinematic. It looked like an apocalypse model.
Right, right.
And it also assumed people would not learn, people would not change their behavior, people would not adapt to protect themselves and their household, their family.
That's right. I mean, there were a number of gross errors in that modeling, and not just them, by the way. There were other models that made the same mistake, but I alluded to before the importance of voluntary responses. So it's known in economics as economic epidemiology, that people change their behaviors in response to risk. And they actually, if you read their paper, they acknowledge this in a footnote that, oh yeah, we know this exists and it's going to be an important factor, but we're going to ignore it anyway, which is essentially what they said. So they ignored it in their modeling. They made other errors. There's what's called the reproduction number, which became popularly known as the R0 or RT. In other words, how many people would one infected person infect? And they used a tremendous overestimate for that, number one. And they said it would be fixed, which we knew wouldn't happen because as more people get infected, there's increasing immunity in the population. So the RT goes down because each person will encounter fewer previously uninfected persons. So that was wrong. There were a number of other errors too. The infection mortality rate they were using was grossly overestimated because it was basically based on the number of confirmed cases, whereas testing was very spotty. So there were,
so it sounds like you don't think we've learned the lessons yet.
No, well, I don't. I do think some people have learned the lessons, but I must say, there's now a push for sort of, fighting the last war. People are thinking, oh, we now need to plan and we need to have this preparedness as if we're fighting the last war. And in fact, we fought the last war all wrong anyway. And I do think that a lot of people have not learned that lesson. I think, people at CEI and people at Paragon have learned that lesson. And I think some in Congress have learned that lesson. But sadly, I think some in the public health community have not learned that lesson. And perhaps the greatest lesson I think they have not learned is that, as Brian alluded to, there are other side effects. There are other impacts on society that come from these types of measures that there's sort of public health orthodoxy was unwilling to consider.
We have a technical question, which is like fire straight into my veins here. I love this sort of thing. I know everybody does not, however. So quickly, could one of you tackle the following? How do we disaggregate the various drivers of population movement from the COVID response? For example, the SALT deduction had a huge impact on the total tax liability of residents from high tax states like New York, New Jersey, and California. So I think the question there really gets at, did you try to pull apart and tease apart the different motivations people had for why they were moving, or did you just look at total migration?
So I can take that. I mean, it's a good question. And so the SALT deduction, if it took place, I know it passed Congress in December 2017.
Well, it started to really pinch in 2019 with the 2018 tax year.
So it would have been in advance of, so that would have been sort of somewhat accounted for in the pre-pandemic movement period that we have. So in that way, yes, we would have sort of accounted for the initial part of the impact of limiting that deduction. But it's not, I mean, what we did wasn't perfect, right? It basically looked at from the summer of 2014 to the summer of 2019. That was our sort of the base period that we looked at. And then we looked at the summer of 2020 to the summer of 2022 as sort of the post intervention period, the intervention being the pandemic. I mean, clearly the pandemic, nothing was on the magnitude of the pandemic in affecting the American economy during that time period. So, I'm sure other things mattered as well. But I think it's just sort of our sort of rationale is that those things didn't matter as much as the huge intervention that happened in the middle of that period.
And it's I think worth noting also, if you looked, as we did at California and Florida, you saw a continuation in 2019 of those pre-existing patterns. So California was having a huge increase in out-migration. Every year was an increase, going right through all those pre-pandemic years, including 2019. And New York's, was relatively steady. There was no bump in people trying to leave New York. So what we saw was sort of a continuation, and we would have expected, there's no question the SALT deduction did impact some people, convince some people to leave, but at least sort of, we didn't see any marginal change in that 2019 year, which you might have expected if that was the major impetus for them to change their venue.
Yeah, for instance, to go through these two states. So New York, on average, I mean, they lost about 100, they were losing about 180,000 people a year in the pre-pandemic period. And that was pretty constant. That was slightly below, above 180,000, but that's where it was. And then the first year of the pandemic, they lost 350,000 people to other states. California was averaging,
so we're seeing it's something in the order of like an 80% jump.
Yes, and California's was more extreme. If you take their 5-year average, it was something like 140,000, and then the 2 years in the pandemic, their average loss exceeded 350,000. So you're looking at 2.5 times as many people leaving California in those 2 pandemic years.
Yeah, suddenly, Arizona, Nevada, they're open for business for newcomers. I have another question here. This comes from Sandy. I would put to you the following. A major variable that was not taken into account in early models was indoor versus outdoor air. We did not have central heat or air conditioning during the Spanish flu. In the migration patterns, did you measure outflow from cities to suburbs or rural areas to avoid the indoor air problem with multifamily housing? Now, I know Joel touched a little bit on population density, which is a kind of sideways or backdoor way of getting at that question about multifamily housing. But were you able to tease apart the cities to suburbs or suburbs to rural, cities to rural, to get at this multifamily housing question? Is that in the report or in the data for a follow-up report?
We do have that. It's not, we don't have that table prepared to show you here, but we did adjust for population density in looking at migration. We did adjust for population density. We did adjust for, for population of different states and for density of different states, and found no change in the outcomes. The negative correlation with migration continued in roughly the same magnitude.
I've got a couple different questions and comments. There seems to be a lot of interest about education and the role played by teachers' unions and the specific policies that might have been adopted in different states that had, I guess my question here is, I'm trying to amalgamate here, which policies or which actions, it might be by external groups like a different teachers' union, had the most effect on negative education outcomes? If we were to list the bad policies, what were the bad policies?
Well, I think, this again is not something we did not tease out the different policies in terms of which were the worst, but we were looking primarily in terms, our outcome measure was in-person days of school. And that has been in a variety of studies strongly correlated with declines in test scores, decreasing educational attainment. And by the way, that is an outcome that unfortunately is much worse for the people who are already disadvantaged in our society, for the less affluent, for various minority groups, people coming from lower educational attainment households. And those are effects that last, in some cases, or may last forever, and they'll be reflected in lower educational attainment and lower incomes over the people's lifetimes. So, we did look at those issues, and we think that was probably the worst thing that was done, keeping schools closed. I mean, requiring kids to wear masks was not particularly good either, because it had long been apparent, that masking as a general population measure probably doesn't really add much, if anything, to improved health outcomes. But we were particularly focused on the in-person schooling.
Yeah, I mean, I think. Well, I think clearly,
Brian.
So there are differences in the political strength of teachers' unions across the country, because some states kept schools open. And I think it also gets to the fact that closing down schools, and Joel said this, but just to emphasize, it was really bad on lower income kids. I mean, if you have upper income families, they could get tutors. They could, make sure everybody has the technology. I mean, I think sort of just at-home learning was easier. Devastating in lower income communities, and those costs will be borne for decades from that loss of 1 or 2 years of schooling. I also just think it was like trying to do, Kent, I don't know what you did with your kids. We tried to do virtual learn. It was just an awful experience. One, the kids didn't learn anything. It was enormously stressful for the parents because you're trying to go about and work, but then you're also trying to set up the various devices throughout the house, and all the while that they're not learning anything. And I mean, that was for my wife and I going through that experience in the spring of 2020. And then Fairfax County, I don't know if you remember, so I lived in Fairfax County. Mm-hmm. They gave a survey to the parents whether they wanted to go back part-time, like a hybrid model, or not go back at all. They give the survey out. The community was split. 2 days later, the superintendent says it doesn't matter how you responded to the survey. And my wife and I were like, we want our kids to resume as much normalcy as possible and go back to school. Doesn't matter how you answer the survey, schools are shut down. It was at that point where my wife turned to me and said, tell me about your idea to move our family again, that I thought was crazy. Because and it had to be that the teachers union was just saying to the school, we're not going back to school. And the Fairfax County, the school board and the superintendent, they weren't prepared to fight with the teachers unions on that.
I will say only two things on that, Brian, for fear of getting myself into deep trouble somewhere. One, I long ago married a woman who's much more talented and intelligent than I am. And two, she is a saint. So
Yes.
we had 4 kids at home doing 4 different models of learning or not learning, as the case may have been. I want to sneak in one last question before I ask the two of you for any sum up thoughts, because we are approaching the hour, and a lot of our guests, they've told us through feedback. We have a feedback at the end of each of these sessions. We ask people to ask 3 or 4 questions that they really appreciate how we keep on time. They can squeeze these things in during their lunch hour or in the evening. But a quick question for each of you before we summarize. I just want to pick up for a moment. We spoke about it just now in terms of education and long-term effects on communities for that break in education. But did we learn anything? Do we know anything about the more severe or less severe lockdown rules with respect to economic gains for states that were more or less wealthy at the beginning, right? I might imagine or theorize and then go try to study. Connecticut has more wealth than New Mexico or Alabama, and therefore those resources in reserve allow for adaptation in a way. Do we see kind of long tail effects on people that started with a lower distribution of wealth, states that started with a lower distribution of wealth, or is it just too soon to pull that out of the data?
Well, that's something we did not adjust for, and I'm not 100% sure I would know how or why that would necessarily be affected by pre-existing, per capita GDP, for example. But that is not something we adjusted for. But as I alluded to earlier, many of these effects impacted the low-income communities far more than they impacted, more affluent communities. So, for example, the people who are we do know that people of lower incomes were less likely to be able to work from home. So they were, number one, more exposed to viruses. They were dealing with the educational problems and differently than more affluent communities. So we do know that, but that, as I said, is not something we adjusted for, and perhaps we could do that in future study.
Well, we've got a lot of lessons in your study and your report, which is available online at the Paragon Health Institute, as well as at CEI.org. It's been a great conversation. I do want to remind our audience that as we conclude, there will be an automatic pop-up survey. It takes only 90 seconds. Not only do I, but several people here read every single response. We try to curate and improve our programs, which reminds me we have a very full program of events coming up in the spring. So stay tuned to your email so that you get notices and alerts about them. I do want to ask, I think I've got about 90 seconds left. First, Joel, and then Brian, do we have any takeaway closing thoughts that you want to make sure our audience hears?
Well, I think what we should learn from this episode going forward is that, number one size fits all policymaking doesn't work. You have to be willing to adapt to the specific disease threat, to the specific conditions in your state or locale. If you're lucky enough to figure out early on who's most at risk, you should focus on protecting them, not imposing all sorts of restrictions on the general population. And number two, you have to be willing to balance what you think are the health effects, even if they turned out not to be health gains, with other considerations like educational outcomes and economic outcomes, both because those two things are important. They're important to people's liberty and functioning, and because they circle back and have an impact on health themselves.
Brian, last word goes to you.
Joel hit the big two. I agree with those. I'd say another key lesson is we can never let the public health establishment have that much power again. they took a crisis and they were given so much power, and they were just singularly focused on one thing, which was to minimize the spread of the virus. And they had blinders on, and they didn't consider all the costs of their various policies and edicts. And we just can't, I mean, it's clear now how wrong that approach was. And I just think we have to never let that happen again.
Well, thank you both for the conversation and for the high quality scholarship. I think perhaps too often we let thin scholarship or something that passes as scholarship come into the political debate, but this is really good work that builds on previous work by one of your co-authors, Casey Mulligan at Chicago. And I'm looking forward to a lot more from both of you on some of these public health questions. With that, if everyone could do two things for me. First, fill out that survey. And second, when you receive the follow-up email thanking you for joining us, be sure to share with a friend or many friends a link to the online captured version of this conversation so that more people know what you have just learned about. Very best. Thank you all.
Thank you.